So what is the purpose of acute trauma rehab? Well, there is very clear evidence now for many years that to get good long-term functional improvements in outcome, you must access rehab early. Goes without saying, isn't it? You know, once you've recovered from the physical injuries in terms of the broken bones, you must start getting the muscles stronger again, getting up. If you have a head injury, working on your cognitive processes to get you back to functioning to a normal level. 3,187 patients in 2013 in our hospital, 2017 in our hospital. How many trauma beds do we have for acute rehab in our hospital? 8. Each patient needs to spend between 6 and 8 weeks for intensive rehab. You can do the maths. This does not work. So what do? We can't keep everyone in the major trauma centre, so we have to repatriate them back to their local hospital or their trauma unit. And that has limited expertise, of course. It cannot all be delivering major trauma care. And so there's a drop-off when patients go there. They've had all of their life-threatening injuries fixed, but the access to specialist rehabilitation is very limited at the trauma unit. And what happens if you don't access this acute rehab early? Mobility falls, you spend longer in hospital, and then the complications start to build up. Patients, muscles will waste, they're more likely to get infections, more likely to get blood clots. And overall, their length of stay is increased, further impacts on the NHS. And when you look at brain injury is even more of a problem because there's no treatment for brain injury. There's absolutely no treatment for brain injury. Once you have fallen off of a building, you've been involved in road traffic collision, that primary brain injury is done. All we can do is wait for the healing to occur and to support that healing process. And that supportive healing process by rehabilitation is the most important thing to turn a brain injured patient who may have a very poor quality of life and functionally very limited to actually somebody that can go back to hopefully as near to normal as possible.
So before the 3-year period had even cropped up, the two parties consensually had worked together, had investigated, had got the claimant rehabilitated as much as possible, and had been able to conclude her case swiftly and effectively. Part of that was the availability of the police evidence. We need to know the detail of the scene, because again, I've told you, judges need to make incredibly detailed findings about how an accident occurred, and we need to be able to anticipate those ourselves. So the precise place, skid marks, scratch marks, gouge marks, weather conditions, vegetation that's obscuring vision, parked cars. In the criminal context, police statements are usually taken with a view to establishing the culpability of the driver. Witnesses in civil actions need to cover much more, far more issues in different detail with a different focus to the criminal context. We need to be able to know about all of the circumstances of the collision. We need to be able to know about what the person who was injured themselves was doing to establish contributory negligence. So the very worst thing we can do in the civil process is only, say, 2 or 3 years after an accident to discover who a potential witness might be from a police report, to see their name, to see a very short extract, perhaps in a pocketbook, perhaps typed up later from an interview, and then go to them 2 or 3 years later and say, now, we actually need to ask you something slightly different about how this accident occurred. You're not entitled to hide documents. Anything one party gets that's relevant to the case, the other party will get. So if you release police reports it's not that you're putting an unfair advantage on one side or the other. Police reports that make their way into the hands of one party or the other will almost immediately make their way into the hands of both parties. Because parties are required to disclose not only the documents you rely on to win your case, but documents that are adverse to your own case, documents that are adverse to somebody else's case, or perhaps support another party's case. So even before the formal litigation process has begun, we all know that. And those are the standards that we work to in civil proceedings.
Civil side is not somewhere out there. It's not some kind of, side add-on. We're under the same judicial system. And what that actually means in reality is we're under the same confidentiality guidance as you are. You can't disclose something to us and me sell it to the Daily Mail. That's not what happens. You disclose it to me, I still have to hold it confidentially. When do we need information? We need it quickly in the civil sector, and why? So we heard from Ross earlier about that early intervention, what it matters about the people at the end. What I'm going to focus on a little bit is what is needed. So we have these wonderful concepts, I'm sure, from a collision investigator's point of view. Well, we need some measurements, we need some photographs, we need the video. But it goes a little bit deeper than that, and I want to talk about that in terms of data integrity. I am not saying or suggesting that anybody is deliberately being obstructive. I'm not coming at it from that point of view, because I don't actually think any of you are. The position I come from is we're making loads of forensic mistakes without even realising it. An image, a video, is not the bit that you see. Or rather, it's not just the bit that you see. All of the goodies in video and video analysis are under the hood. They are in that digital file. So why would you be in a position of instructing an expert and tying their hands before they've even started? Just in the way that you've handled a forensic exhibit, why would you deliberately introduce artifacts into something which means we're going to be able to tell you less? That is clearly nonsense. There is only one way to disclose a forensic digital exhibit, and that is a bit-for-bit copy of the original. It is identical in every way to the original. Anything else is a copy. Anything else, you've lost integrity by definition. So the only thing that serves as a proper forensic working copy, a proper copy that you can reasonably expect an expert to work on, is a bit-for-bit copy of the original. If you are going out to SPIs, if you are one of the still the few forensic units going out to serious personal injury crashes that you know you're not going to write up because they're not fatal, or you think it's life-threatening and you get to the scene and then you get that packed down, oh, it's okay, just had an update from hospital. Please, because we talked about the victim, that quick intervention, some of that prosthesis is just phenomenal. Please jump out the van. Please take some photographs. Please take a couple of scans. Yes, I know you're going to have to book that in when you get back. I know you are. And I know you might have to write an MG11, which, let's be honest, is already a pro forma, so you're going to have to fill in the blanks, yeah? But this makes a difference to some of those cases that we saw with the victims about what they can access for 5 minutes of your time and you're already there. That's just a personal plea. And remember, above it all, that civil doesn't start at the conclusion of the criminal case. Civil starts day one.